And just before we move on to our panel discussion from the MSYPs who have kindly joined us today, we're going to hear their manifesto, which they've pulled together by consulting with so many people. They've done an incredible job. So we're going to see a short video about their manifesto before we move on to that panel session.
They say we are the future.
As if we aren't living in the now.
They say we are too young and inexperienced, as if we can't think for ourselves.
So who are we? Well, look around you. We are your students, your carers, your volunteers, your workers, and your representatives.
We're innovative. We're diverse and inclusive. We're open-minded. But we're struggling.
They expect us to work like adults, but we're treated like children.
We are the ones carrying the weight of the decisions that we never asked for and being still expected to smile through it.
To wait months or sometimes years for the mental health support we need.
We miss opportunities we deserve, like work, education, or a social life, just because the bus never came.
Or to stay silent when some of us aren't treated equally because of who we are.
These are just some of the issues that young people are dealing with in Scotland.
The same issues that we are determined to fix.
By 2031, we want these issues to be history, not reality.
This new manifesto doesn't speak for one party, it speaks for us all.
Because we are the solution, and at the Scottish Youth Parliament, every voice counts.
This is our moment.
I think we can all appreciate what an incredible effort it was to pull that together from the MSYPs. So I'd like to invite the three MSYPs who are here today to join me for their panel discussion. So we'll split this into some questions that I'll ask the MSYPs, and then if you would all like to have a think about some questions that you would maybe like to ask, and we'll come round halfway through and invite some audience questions as well. So if you would like to all introduce yourself, I'll start with you.
Thank you. I feel like I'm in Parliament, in like the committee rooms. That's quite fun. Afternoon, everyone. No, I'm kidding. After that lovely lunch, it is indeed a good afternoon. My name is Rajsee. I am an elected member of the Scottish Youth Parliament and recently elected trustee to our board. I represent my constituents from Glasgow, Pollock, miles away and famously known for the weather. I am 17 years old, I use she, her pronouns, and today I'm wearing a black blazer and a maroon dress. I've got mid-length black hair in a braid. For context, the reason that we do a brief visual description is just if there are people in the room that are visually impaired, just to help create a more accessible and inclusive environment. I'll pass over.
Hi everyone, I'm Ife. I'm the MSYP for Edinburgh Eastern. I am wearing a white jumper, I have brown hair. I'm part of the Health, Wellbeing and Sports Committee within Scottish Youth Parliament and the Manage Your Time panel and Mental Health Campaign Planning Group. I'll pass on to Amna.
Hi everyone, my name is Amna Ansar. I'm the MSYP for Edinburgh Penlands. I'm wearing a beige jumper and a white hijab. And I'm also a part of the mental health campaign in SYP.
Perfect. So just to kick us off, to develop the manifesto we've heard about, you've been out and about engaging with and hearing from lots of other young people. What are they telling you that matters to them? And I'm happy for you to answer in any order.
Yeah, thank you. So I think I'll go first. I think that was a great question, absolutely. So the Scottish Youth Parliament consulted just under 5,000 young people. In fact, I know it's 4,889 young people across every local authority in Scotland. And we're essentially asking these young people, what do you want for us to do, essentially, to make things better for you. And we've got 31 policies in our manifesto. Just going to hold it up. I was actually thinking about making this joke, but I feel like I'm a flight attendant here. These are your emergency exits. This is your manifesto. And throughout the policy issues, we've seen that young people have been asking again and again, but more specifically in this, to be included in all decisions that affect them. So that's from things like taxes and national budgets to community planning to curriculum setting. And some of the policies in our manifesto are quite contentious, quite controversial, but what we are all more than pleased to say is that everything has been kind of responded to and engaged with in such a respectful manner, which is a really good turnout from the young people.
Does anyone else want to come in on that? Okay. So how does the NHS need to change in order to better support young people and their needs?
Yeah, so one of the main priority issues for young people is access to mental health services, which includes prevention and early intervention approaches, including by investing more in the NHS and in community-based mental health and education is essential. And they also want to continue to protect NHS from privatization and to keep it free at the point of need so that young people know that they can access it reliably and consistently and without any barriers.
Thank you for that. So do you think young people are given the opportunities to meaningfully participate in their healthcare decisions?
Yes, I think to some degree we do have the opportunity to meaningfully participate. For example, in addition to sort of all the experiences I listed during my introduction, I do some work with the NHS 24 Youth Board. So in doing that, we get access to sort of, for example, recently we gave feedback on the anti-racism action plan. We've also done things concerning AI in general practice in pharmacy, and I've also been able to be part of various youth advisory boards, including health inequality youth advisory boards or consultations based off CAMS research. So we do get quite a wide range of things, but that could be utilized on a much larger scale. I think it comes with the caveat that there is still room for increased accessibility. Myself and a large amount of the people within the NHS 24 Youth Advisory Group had found the advisory group through doing our own research and looking out for opportunities initially before we were given access to further opportunities. And I think if we weren't already within these sort of policy-focused spaces, if I didn't do Scottish Youth Parliament, for example, I might not have access to these sort of opportunities, and that means that these opportunities are sort of limited to people who are already in the know-how about all these healthcare policy sort of advisory groups, and it means that the sort of demographic is quite limited to people who already have those opportunities, and it sort of results in a cycle of the same few people being promoted to experience such opportunities, which I'm aware that NHS 24 has heard our feedback from this and taken efforts to tackle this, such as through visiting colleges or universities. But I think there's a large scope for improvement in terms of attracting a wide range of people and making such opportunities more available. And I also know that in more rural areas, for example, they gave feedback that it's difficult to travel to such opportunities. So I think all of these are factors that could be improved in terms of meaningful participation.
So we've got a lot of clinicians in the room with us here today. Do you think clinicians have a role to play as a trusted adult for
Yes,
young
of course. When we received feedback from the manifesto, a large majority of people, I think it was 83%, wanted to have meaningful participation in the sort of the things that affect them, to be in the rooms where decisions are made pretty much, and that's as part of the UNCRC, which has been in practice since 2024. So included in the UNCRC, it states that people should have the opportunities to have meaningful participation and have access to trusted adults, including within healthcare and from clinicians and from sort of people, people practicing healthcare pretty much. So it is very important that young people have access to sort of people that they can seek advice from, which I can detail more later. I don't know if anyone has anything else to add.
And do we think NHS services are delivering for women and minority groups?
Yeah, I don't mind coming in on that. So in my own experience 6 months ago, I was in the A&E and one of the staff there asked me if I could speak English. You know, take from that what you will, I suppose. But I think there is like a lot of room for improvement. And have room. If you were here this morning, you'll have heard me probably ask a similar question. But in terms of increased funding for specific conditions like PCOS and endometriosis, as they significantly impact girls and young women. So I suppose just looking at policies with a more intersectional and gendered lens. And there is very little support in research or funding on the effects of these conditions. And alongside this, I think this is quite often forgotten about, but we do need more support for the advocacy services that ensure women have the right to quality healthcare. And taking it further, the other point that I would make is just making more direct investment into gender sensitivity training to help understand how gender influences healthcare well-being and physical manifestations of health. So obviously it's different depending on who you are.
I think that's something we have in common. We've got an ask within our Chest Heart Stroke Scotland manifesto to ensure that there's more sort of gendered research done to ensure that women are prioritised for research and that it's not skewed towards men the way it has been historically. So yeah, that's something we can certainly reflect upon together. There's an assumption that young people are more likely to gravitate towards online health advice. How much do you agree, engage with that kind of information versus an in-person community service?
So, as I said before, young people, we obviously value relationships with trusted adults, including youth workers, and being able to ask people questions without having sort of a perceived judgment or bias against us because we're young. Where we can't access this, of course, people might be more inclined to look towards the internet for support. Youth work services are currently underfunded, which is something that we talk about in our manifesto as well. And it's important to tackle this because it's impacting the support that's available for young people, especially at sort of as a preventative measure at lower levels before health issues sort of escalate. And this affects people largely in rural areas as well. So we want to see that youth work services are they're funded in a more transparent way and that young people can hold decision makers to an account in their funding decisions and have sort of consistent high quality youth work provision across Scotland. We also talk about community-based healthcare. Young people have told us that this is something, of course, they'd want to have access to. So, you know, with higher quality provision of these services, people would likely be less likely to lean towards seeking advice from online services, which might have misinformation. And that's something we also try to tackle through Mind Your Time in Scottish Youth Parliament, which is a sort of online-based information, like digital information site that we created within the focus group. So through improving youth work and through improving community-based health services, young people can have better and higher quality alternatives to sort of seeking information online.
I think it's worth tackling that perception that young people always just want online information about their health, and actually getting it in their communities in person is actually still valued,
exactly,
regardless of age. Thank you for that answer. We turn to audience questions. Has anyone got any questions for the MSYPs? We've got a question. We've got the mics coming. Dora's just coming down with the mic. Brian's got a question here.
Sorry, thank you. I have to ask this. You were talking to some 5,000 or so people, youth. How much of when we talked about prevention, which I was delighted to hear you say, how much of being physically active, having that opportunity to be local community-based activity and that interaction that we know benefits physical and mental health, how much of that was highlighted in your research?
I'll go first and then I'll definitely pass along because I know we can all represent our own constituencies in this. So I'd say that we've got a range of kind of policies that young people have agreed with in terms of engagement in local communities. A lot of it was things like, I think Aoife spoke about you know, youth services in communities, which there's a big support for. In fact, that's one of our national campaigns, one of our priority campaigns, and a lot of young people did support it. I think the statistic was like 83%. It is available in our manifesto if you would like to read it, but just to kind of give you an overall general answer to that, a lot of people did say that they really enjoy the local services that they get, you know, whether it's like online or local clubs, or whether it's like after school provision that there is, or any kind of engagement that they've got in their community, and that they would want to see that expanded. And I suppose that was shown in a range of ways. So it's not even just like community-based like engagement for like young people after school, but even things like the Young Scot card that we want to expand, if not maintain that provision. So just in a range of ways, if that kind of answers your question.
Also, to add to that, we had 91% of respondents saying that they would like more access to sports and leisure services, especially in rural and more deprived areas. So it's again this same sort of feedback concerning rural areas where they don't have sort of enough provision and enough support. And young people have also told us they have concerns about their physical and mental health, which they link to sort of a lack of affordable services when it comes to sort of sports and leisure centres.
Get any other questions? Yep, just there, Dora. Oh, perfect. Thank you.
Hello there. I'm Sally Peterson. I'm a GP, but I'm also a clinical lead in Perth and Chris Ross Health and Social Care Partnership. It is absolutely fantastic to have you here, and I really love what you're saying. You've got a lot of people in this room who will be involved in reform of health and social care. So I would like to know what one piece of advice you would like to give us that we can take away.
What a great question. Who wants to go first on that one?
I feel like for me is to like listen to more young people. I think like in your like perspective, you think that like people sort of like look for Google for like answers of like what they're feeling right now. But the reason why they're doing that is because they're not feeling supported by the system. So like, and also like we are sort of the people who are going to be like affected by your decisions in the future. We're gonna have to like live through it. So definitely like listen to more young people and like without any judgment. And yeah, I mean, that's why we're basically here, but yeah.
Yeah, I kind of like to echo that. I think that's an amazing point. And to make sure, young people, that when you look around the room, there's as wide and as varied of a demographic of people as possible. Because again, you don't want the same echo chamber where it's the same people giving their voices and their opinions.
Yeah, absolutely. I completely agree with what you guys have said. You've kind of stolen my thunder here. I've not got much to say now. But just reiterating that idea of like meaningful engagement with young people over a sustainable amount of time. So, you know, I think almost every like educational provider, like schools, colleges, universities, will be part of the RRSA, the Rights Respecting School Award. Because I think, well, obviously with the UNCRC now incorporated into domestic law, it's kind of have to. And you'll have the ambassadors. I think it's, for my school, we had inspectors from the UN that came over to do it, but they made sure that they engaged with a cross-sector range of young people, so kind of reinforcing that idea, but also that it was done over a period of time. So it's not that, you know, the teachers could tell everyone what to say when this person showed up, but it was carried out across a range of time. Because I think usually when you approach young people and you're like, hey, we want to engage with you, we want to work with you, what are your views? It quite often feels like you're doing this because it's tokenistic, you have to tick a box and go back to your manager, we get that. But if you're like, we genuinely want to hear from you and we'll be back next week and the week after and we want to see how we can work together and create that idea of like collective action, then I think that really gets through to us. So yeah, that's what I'd say.
Yeah, just to add to that, because you just made me think of something now. I completely agree with that, especially where she said sort of, you know, sometimes it feels you're there to tick a box rather than to give your honest opinion. And I think that can be avoided by thinking from a youth perspective, trying to have conversations as youth-led as possible, and not rather than just assume what young people are thinking and what they want to say to you. Try and instead probe active discussion instead of just making assumptions, even if it's assumptions you've made based off like what people have told you previously. You know, people have different perspectives. So what I like about Scottish Youth Parliament is they encourage us to pretty much do as much as we want on the issues that affect us and to find out as much as we can about the issues affecting other young people, rather than telling us this is the issue that affects young people, so solve it, if that makes sense.
Also to add, this is not just our opinion, by the way. 90% of the young people want to have their views heard on matters relating to them. This also includes like personal finances, tax and economy, and for the financial education to be available to like all young people in Scotland so that they can comment on these topics.
I think that's really powerful, isn't it? Huge amounts of young people want their voices to be heard, and I think that should resonate with us all. It's not just these 3 MSYPs that we have here today. It's much larger volumes of young people that want their voices to be heard, and we should all make sure that we're listening and acting on that. Any other questions? Up the back there. We've got one there and then one over here as well.
Do you want me to go first? Thank you. Michael Kellett from Public Health Scotland, just to say, and echo what you've just said, Amy, how refreshing it is to hear from you today, MSYPs, and about the kind of parallel debates we've been having today around how we improve the health and well-being of the population and how we reform and improve the NHS. I was particularly pleased, Ify, about what you said about false information and misinformation and recognising the importance of that. That's something we think really hard about in Public Health Scotland, because we're responsible for vaccinations and how they are rolled out across the country. I had a particular question around that agenda around improving health and well-being, and it's around social media. And just to ask, in terms of your manifesto, do you make any suggestions there? In Public Health Scotland, it's something that we think quite hard about. We recognise the benefits of social media and connectingness that it brings, but we also understand that there are risks in terms of the particularly the mental health, particularly of children and young people, and just wonder if you have any views to share there. Thank you.
If one of you guys wants to look for the policy in the manifesto, and I can talk about phone bans, a little bit off topic, but I think within the general vicinity, and you guys can quickly search up if we do. I believe that we do, so I'll give you guys, I'll stall some time. So this isn't in the manifesto, but at our last sitting, we have like national sittings where the whole membership comes together, so like 160 MSYPs, I know, loads of young people, and we come together, discuss ideas, debate, propose motions, and just represent overall our constituents' views. And I think it was one of the MSYPs for Fife, I want to say, that proposed phone bans is a really bad idea. So kind of on a similar line to social media by extension, then you start to see schools, teachers being like, oh yeah, I don't think phones are a good idea. But what we're saying is that taking phones off young people will not actually lead to anything. In fact, it's just going to probably lead to rebellion, because young people are not going to like that. Rather, if you ever want to like change something, you can't just tell people like what to do. You need to take them on that journey with you. You need to reason with them. You need to explain your point of view to them. And what we're rather saying as part of that motion is that if you essentially explain to young people that we don't want to take your phone off you, we just think these are the dangers, these are the damages, and we're going to actually help hold the companies that are giving you this disinformation accountable, then you see that young people really won't pay that much attention to what's going on. So that's just a little bit on the phone ban. Have we found anything in the manifesto?
So we do cover social media to a degree in both our sort of roles of trusted adults in healthcare, and also in having access to fast and reliable internet and social media use. So we do talk a bit about sort of making sure that people have access to the right information. and that does include social media when it sort of regarding their health and regarding the meaningful participation. But for sort of more specifically, in our social media sort of section, which states that 83% of people agree that everyone should have have equal access to sort of the digital world. Young people called for increased media and critical literacy skills to be embedded throughout the curriculum, because clearly it was seen that there was a lack of media literacy among our constituents, and that would include sort of learning how to decipher between fake and real information online.
Also, just like to add on to that, for young people of like today, social media is like one of the biggest way to like be in touch with of the world, to be like aware of like what's going on around the world, because like they're not going to like sit around and like read a newspaper or like watch the news. So yeah, social media is like important to young people on a daily basis.
SYP do try and kind of facilitate try and raise awareness of kind of the pros and cons of social media. So like if you said, we're both screensavers, so we're part of the website. If you search it up, it's called Mind Your Time. Awesome resource. I'm not biased, I've not been told to say that. And yeah, we were part of the people that, basically young people that created it, and it talks all things misinformation, disinformation, AI, and it's a great tool for young people to essentially see that intersection between what they do when they go on social media, but also how it affects them when they're not on. And then we also have another programme with the NSPCC, and we are essentially called Digital Safety Ambassadors. So the Scottish Youth Parliament do hold like a range of online safety working groups and stuff, but yeah, hope that kind of answers your question.
Yeah, I think that's a really timely question, because mis and disinformation is rife just now, and we need to know where the trusted sources are. I mean, we've heard mis and disinformation in our nation's parliament, for instance. We need to know that there are trusted sources out there, and it's about holding the social media companies to account and actually knowing and educating our young people to know, and adults as well. It's not just young people that fall victim to this. Adults are, I don't know what the statistics on this are, but potentially more likely to fall victim to this than young people are, especially with the rise of AI, and not knowing what the trusted sources are. So we need to make sure that people know what trusted sources are. So I think certainly that's something that is on our radar as an organisation as well, as Public Health Scotland's. So we've got up to the gentleman at the back there.
Yeah, thanks very much. I was just wondering about the role of food and the extent to which that had been identified as an issue for members of Scotland's Youth Parliament. Angelina mentioned it in the earlier session, and it's identified as one of the real priorities for reform in the population health framework. So it's linked to the growing levels of overweight and obesity that we're seeing in Scotland, the huge amount of health harm that creates. And we're identifying the need there really for a transformation in Scotland's food environment so that healthy options are much more available and affordable for all. Clearly that needs to include young people, but I just really wanted to know and to understand whether that was an issue that young people themselves have raised in Scotland.
Thanks so much for that question. And just for the benefit of the SYPs, in case you aren't aware, the Population Health Framework is a framework from the Scottish Government on how to tackle health inequalities, essentially, especially aimed at deprived communities, and it covers things like food and nutrition and how to best tackle health inequalities, essentially, is my kind of brief summary of it. There's much more to it than that, but that's the best. Housing, other issues like that come into it as well.
Yeah, thank you for that. That's actually really helpful. It gives me a good insight into the kind of context of the question. If you guys haven't found it, I think it's page 15 on our manifesto. So I was just quickly having a look for it there. We do. I don't think it's entirely, I don't know if there's another policy that's directly linked to kind of the awareness of diet and in terms of what we eat. I do know that there's another third sector organisation that the Scottish Youth Parliament have previously collaborated with called Bite Back. I think they're based in England. The policy that we've got is under our education theme, so we've highlighted 5 themes in our manifesto, and it's policy number 4, where we had 70% agreement that decision makers should provide universal free school meals for all children and young people in Scotland. So I think it's more what the young people have brought to us is that kind of championing in spaces of this is what we demand, this is what we want, and it's obviously a universal kind of healthcare right that we would expect when we go into school. I don't know if you guys have anything you want to add.
Yeah. Oh, sorry about that. A major point within that was that decision makers should increase opportunities to learn about food health and nutrition and where our food comes from in a way that's sort of accessible to young people and engaging and safe. So that includes making sure people are more aware about the effects of the food that they're eating on their bodies.
Okay, so we've got, does anyone else want to say anything? We've got time for maybe 2 or 3 more questions before we move on to the next session. Has anyone else got a question down here?
Thank you. Can I take you back to talking about digital things? Interested to know if the Parliament or indeed the manifesto explores the issue of digital poverty. Recent work at Oxford University has shown that young people under the age of 25, that 26% of them do not have access to digital platforms, social media, or indeed the internet. And as increasingly our health provision and care provision is through digital platforms and mechanisms, it would be interesting to know whether you've explored that impact on young people in particular. Thank you.
I think that sort of like covers in one of our policies about everyone in Scotland having access to like fast and reliable internet, which 83% of the young people that we've like researched agree that it should be the case, regardless of their geographical location or financial situation. So like they do see that like everything should be equal when it comes to like internet, and yeah.
I think we made a really good. Oh, sorry. I could probably speak without this as well, though. Advanced higher drama. I think in terms of, you made a really good point in terms of the digital divide, that there is definitely one. And I completely agree with Amna. I think I'm trying to recollect, but I don't think we do have a policy that's directly on that. So probably the closest one would be that one. But I feel like that's quite broad, so it does cover parts of it. Kind of blanked what I was going to say. Come back to me, guys. Give me a second.
If it's fine, just take a second.
Just to add to what Amna was saying about this one specifically and what you're thinking, it does mention digital exclusion and poverty and the effects of that on young people's access to education, and also improving the infrastructure, wow, I can't say that word, to provide it to more young people across Scotland equally.
I remembered. So yeah, I don't think this is in our manifesto, but this was a topic that we spoke quite a lot about at our national sitting a month ago in Paisley, and it was that if we're being given like a phone ban in school, how are you ensuring that every young person has an equitable access to an internet source? Like, how are they going to complete this homework? So we've essentially called the councils provide like some form of access to the internet. So I can speak for Glasgow that Glasgow City Council, I don't know how much they've spent, probably like millions, but every young person now has an iPad, which is insane, and that helps a lot with us in linking back again to the phone ban, the social medias. We don't actually go on our phone anymore because there's no need to. So we just have that iPad, and that's standardised. I believe East Wren, which is like one council over from Glasgow, but still within the kind of central belt, they've got like, not Chromebooks, it's like the other laptop, probably another fancy brand, but they also have access to that and they get to take it home. So just things like that I think definitely help with cutting down on that digital divide. But I think those are things that you kind of see at the top of the iceberg. They still don't deal with the root cause. So there's still a lot more to be done with it. But I think that's all that we are doing at the moment.
Have we got any other questions? Perfect. Yeah, up there. Making Dora run.
Hello there, thanks. I'm Chris Gregan from the Health Foundation. We've got a session coming up after the break, which is a panel of politicians from Holyrood to talk about whether or not party politics are an obstacle to reform. And I wondered, based on your experience of working together in the Scottish Youth Parliament, whether you've got any advice for that panel.
Who wants to go first on that? That is zinger of a question.
Ona is. But we are sort of not party focused. We're more like representing all of Scotland. So we don't focus on sort of specific, between party sort of policies. We're more looking out for everyone regardless. So I don't have specific advice for individuals, but rather just in general.
I feel like I'm just gonna repeat my point of like MSPs listen to more young people, and actually especially when like making decisions that directly impact their lives. Like for example, I don't know, maybe like changing the curriculum, for example. Like education and school is like a big part of a young person's life. Like you cannot just make a decision without asking what young people are thinking and then just expect them to be okay with it and then go through with it, you know? So probably ask them and listen to them, as I was saying earlier, and that's it, really.
I think in my opinion, I just obviously want to reiterate that SYP is politically impartial, so we can't give specific advice, but what I would say in general is just ask, I guess, all the candidates to not confuse, they'll know this, but not to confuse politically impartial with apolitical, because I think quite often the stance that happens is when young people disagree with a candidate or their view, it's quite often easy to think that, oh, they just don't care, they don't know, they're uneducated and they're not bothered with it. When in reality that's not the truth. I think that's quite a false narrative. Every young person that I've consulted really cares about politics, you know, whether that's about, like you saw in the video where Daniela said, the bus isn't here, or whether it's exams are awful, I want out, or whether it's, why don't I get a free breakfast club at my school? Every young person does care about politics, and if your policy, if your party policy doesn't align with their interest, don't shut them out. I think that's a very dangerous but common mistake that sometimes gets made. So I would just say, try and keep things open, even if you think that they're maybe not listening and they look bored and they're talking. I promise they're listening.
I'd like to add to that as well, because I think a lot of the time, as we've disproven, the assumption is made that, oh, young people are looking online for information, for example. They don't want to access in-person services, or young people don't talk about politics because they're not interested in it. So if you'd asked me like 2 years ago to do a panel discussion like this, I wouldn't have a clue what I was talking about. But because I've had access to these opportunities, I'm more aware of healthcare policy, and I'm able to sit here and talk to you guys today, thankfully. So I think it's more about a lack of opportunity rather than, oh, people are just not interested or uneducated. I think sometimes politicians don't understand the responsibility they have to sort of make sure that people are getting into those spaces and educated about the topics we're talking about, such as today. So I think not making the assumption that young people are uninterested would be a big one.
So then maybe to reframe the question slightly, do you think government use the Scottish Youth Parliament as a proper consultative body if they're making changes to legislation, say, that would affect young people?
Yeah, absolutely. I'll speak for one of the examples and then pass on. But for example, we do campaign on loads of really important things that have resulted in tangible change. So I'm not sitting here making this up. Things like the Young Scot card and free bus travel. A lot of the work was campaigned by and taken forward by the Scottish Youth Parliament. So I do think we do a lot of work with the Scottish Government, but it's not just limited to the Scottish Government. So if you're an organisation sitting out there thinking, this sounds great, we want to interact with them, then let us know. You know where to find us.
Yeah, I think Amna's pretty much said it all. I mean, no, sorry, Rajsee. Scottish Youth Parliament is utilised a lot by the Scottish Government, so I think that's good.
I wasn't sure what that answer was going to be. We're about to have a Cabinet Secretary join us, so I was like, is he going to walk into a bad answer there? Anyone else got a question? Yep, got one there.
A lot of the, I'm Amy Dalrymple from Marie Curie. A lot of the conversation this morning was about trust and about different parts of our systems and different people within our systems needing to trust each other, and that being very relevant about the future of health in Scotland and our National Health Service. And So that's my question to yourselves, and in the work that you've done through the Scottish Youth Parliament about levels of trust, I suppose particularly, it relates to the previous question, particularly in our public institutions. We've talked about trust in, kind of that two-way conversation with government, but what about trust in the NHS actually, and in other, and kind of healthcare charities like the one I work for? Do you have a feeling what levels are like around that?
I feel like I think in young people, like trust in NHS isn't that very big, because they do realize that like the long list of waiting lists, for example, like for mental health services and stuff, is like very long, and it's like really hard to access. Therefore, why they're like turning towards ChatGPT or like Google for answers when they should not be doing that. So that's like one thing about like young people's trust about NHS. And about like third sectors, when I was like asking for young people's opinion, when I was like getting like opinions on the motions that we were debating on the sittings, like a lot of them don't know about the Scottish Youth Parliament or like what exactly is the third sector, if that makes sense. So like they don't have like much knowledge about this. And in fact, like I caught like one person literally asked me like what party I'm from, what party I am a part of, which is just like, again, like I'm not part of any party when I'm like SYP. So yeah, like a lot of them just doesn't have the knowledge about the third sectors or what like stuff that they're doing. So maybe it's not exactly their fault, but it's maybe like the faults of the third sectors that they don't really make them show that much to maybe like the younger people of our society, if that makes sense.
Yeah, I would completely agree with that. Sorry, I've lost you. Yeah, I think it's, thanks. I think that it is unfortunately low, but I think there's still an optimistic note to that it's not low enough that if something was to go awfully wrong, they wouldn't phone if they knew that they needed help. So we're not at that point, guys, don't worry. I think it's just low in a sense that they've maybe had a bad experience or they've heard a bad experience from someone else, and they just think that, if I've got maybe a small problem that I can fix on my own, I'm not going to go because I don't trust that they'll be there immediately to help me. But I think if it was something much bigger, from what I've heard, people do go, and I ask them like, oh, why did you phone then if you thought they wouldn't help? And they're like, well, I knew that they would if I had to. But I suppose just looking forward at next steps, it's about how do we get up from being the last resort.
Yeah, so we're running slightly short on time. In fact, we're slightly over time, but I think we could maybe squeeze in that one last question that we had there.
Rob Murray from the Red Cross. Thank you so much for that last half an hour, so it's been really insightful. I guess the title of the session is Workforce for 2048, but actually you're citizens of today. And I just want to touch on engagement and get your thoughts. Given you are actively involved in using services, you have thoughts around those services, the manifesto talks about young people's involvement in shaping those. What are your thoughts about young people having an active say on public boards, health and social care partnerships, boards, etc., so that actually young people's voice can be at the heart of decision making, not on panels talking about the workforce in 20 years' time?
Thanks for that question, Rob. Who wants to go first?
I can go. So having been part of boards such as the NHS Youth Forum, I think it's great, and I think it should be done a lot more often and on a wider scale. Seeing the resources that are like at our disposal when I go into these spaces, it's quite shocking to me because I didn't see them that often. I wouldn't have known about them, as I said before, if I hadn't gone out and searched for them. Like, for example, the NHS 24, I was looking for sort of NHS work experience, and I came across that. And then I found out about the board. Rather than me having a specific interest in that, or just looking, rather than them coming to me, pretty much. So I think it's a matter of increasing accessibility to these boards and having more of them, pretty much. I think they're great, and I think they should be implemented on a wider scale.
Yeah, same. Like, I think they are absolutely great. And as Ife was saying earlier, even like 83% of young people agree that like the Scottish Government and other decision makers must uphold the Article 12 of the UNCRC, which is to respect the views of children and young people in all decisions that affect them. So like, young people do agree that they need to, like, they are really in favor of like talking in these spaces that will affect the decisions that are being made. So yeah.
Yeah, I completely agree with. There we go. Yeah, I completely agree with everything that's been said. I think it's brilliant, but probably not done as much as we'd want it to be. Obviously, I recognise that not every single charity is going to go out, create a 20-person board just so that we can have young people and loads of good, meaningful participation. But I think it's about that idea again of just interacting and engaging with a cross-sector range of young people, so we're not hitting the same audience every single time. I think the term, don't quote me, is democratic well-being, so it's to the extent in which you're being affected by decisions that you are kind of having a say in. So just that kind of idea there. Thanks.
Thank you so much for this session, and thank you all so much for engaging so well with it and for all your really, really interesting questions. It's been fantastic. I'm now going to hand over to a man who to most of you will need no introduction, given it's an election year next year, so he's putting out a poll that I'm sure most of you will see every other day at the moment. So thank you to Mark Diffley, who's coming to the stage just now. Many of you will have seen some of the polling that he's about to introduce in the media over the last day or so, but he's going to give us a much more in-depth presentation on it just now.